Every master of a ship vessel knows the situation. A seaman gets injured or falls sick. A medical emergency. Every minute can count. For many shipmasters, there is only one place to call: Future Care, a place that manages all maritime claims in the health sector.
Future Care is known to be a medical advocate hired by the ship owner to assist his crew in receiving quality of medical care in the right time frame. And it requires a nurse case manager and a doctor who literally works for the ship owner and his crew, so that when they come into the U.S., we provide them the centers of excellence, and we as the team monitor and manage the medical care in that hospital or at that doctor's office on the behalf of the ship owner and his crew member.
The captain calls or emails with a description of the medical incidents. The crew member's condition is initially assessed by the Future Care's first response team and is triaged immediately to either a nurse or a doctor, depending on the nature of the call. They have the expertise and training specifically related to severe illnesses, diseases, and catastrophes. Future Care has around-the-clock availability to the best doctors who know the hospital's specialties in every port of call.
I've had extensive blue water sailing experience, so I've been a doctor in the Himalayas with limited medical facilities available, doing the best I can with limited facilities. I've been a doctor on board ship in storms. I've been a doctor at emergency rooms in Chicago, in New York, all over the world. I've lectured over the world. I've developed operations in my field. And most important is my experience is not restricted to trauma and orthopedic surgery, but to the body in general.
We view our jobs as not only assisting in taking care of a certain injury, but to be responsible to leave the injured crew member with the knowledge that he has been properly and well taken care of, and when necessary, his family has been kept in the loop and comforted. Since we are a family company, we treat an injured crew member as we would want to be treated. The potential liability for ship owners is extreme. Sometimes the injuries are life-threatening or leave a seaman permanently handicapped.
There was recently a situation where an engineer on board a vessel got a piece of metal in his eye, and I was called, and I immediately got an ophthalmologist, an eye doctor, online. We had a video, a picture electronically transmitted from the vessel to our computer, which I then forwarded to the ophthalmologist, and within literally minutes, we had an ophthalmologist directing the master of the vessel what to do with this piece of metal in someone's eye, and what had been done before would have been harmful. He had a good chance of losing his eye, and within minutes we were able to change that whole situation around.
Christina DeSimone is a healthcare advocate and a managed care expert. Her 20 years of experience have helped Future Care to evaluate the best methods to ensure excellent medical care, avoid litigations, and return the crew member to full fit for duty status.
We developed this program years ago, which allows us to pick the centers of excellence in the United States, the hospitals with the best reputations, the highest technology, and refer our clients to those facilities. We then manage the care from the onset of injury or illness through the recovery process with nurse advocates and clinical reviews of the facility, as well as that Future Care has their own doctors that will effect a strong communication with the hospital or medical facility for which our maritime crew member is treating in. This allows for the quality of care that's needed because the team is held accountable.
Robert Ladmer has been managing all aspects of his marine clients for the past 20 years. His 5 fleets of integrated tug barges are $40 million units that carry very large crews.
We've had very serious, catastrophic type injuries where there are burn victims, where you have to get them transported, right away. Captain is not going to know how to handle this. We need a 24/7 hotline with professional doctors and nurses that could advise us what, should this guy be moved, should he be covered? I mean, to get this burn victim through a nurse case manager is put on right away, which I can't say enough about, because they can get this person, coordinate to the right place of treatment.
The volume of Future Care's business and our organization memberships frequently allows us to get significant reductions in fees by hospitals and doctors. Ship owners are treated as if they were uninsured customers who always pay the highest rates chargeable. There is no rate structure in place, nor is there a coordinated approach to medical management when a seaman seeks medical treatment in the U.S. We are always on the lookout for excessive medical procedures. Future Care makes sure the right choices are made from the inception, which saves lives and money.
The differences in going in without Future Care's representation can value that bill at almost 50 to 80% more without a medical advocate from Future Care arranging the rates. And for a ship owner who has a captain who may have a heart attack on board, that could be the difference between a $150,000 bill and a $85,000 bill. He can present to the hospital with a complicated broken leg. The difference could be 50%. So instead of it being $80,000, it's going to be $40,000. So it's very, very significant in terms of savings. And whenever you're retrospectively trying to take a bill and reduce the fees, you're always going to have limitations. Our biggest belief is that the earlier we receive the case, the more we can control the costs and the care.
The U.S. healthcare system is a for-profit system. Doctors and hospitals are paid by procedures, not cures.
The reason that I stick with Future Care is we were one of the first maritime companies involved in this type of managed care. We led all other companies year after year in audit savings. It wasn't even close. And all it takes is one serious case, just as the hospital case, saving $18,000 on a two-night visit is really a great savings. And so all that case management is really free when you really look at it.
Future Care, managed care, offers pre-employment screenings for its clients. This way, a ship owner can be sure that he doesn't hire anyone with a pre-existing condition, which may end up producing high medical bills.
Well, pre-employment physicals are a very important part of the beginning of the process of controlling the medical claims that occur, both for employers and for maritime ship owners. The pre-employment physicals that are used are sometimes not as detailed as they should be, and what we propose and the way we organize a pre-employment physical is in much more detail. The more that you can find out about someone before you hire him, the more complete your understanding of what your liability is going to be afterwards.
I've always felt that paying up front a couple of $100 for pre-employment screening can, in the end, and good care to keep the seaman seaworthy, can save employers multi-millions of dollars. And that would affect your insurance premiums, and that would affect who's going to insure you on your vessels to operate.
But seamen are hired every day, and they get injured or fall sick on vessels every day. To make sure that all parties involved will feel fairly and safely treated, Future Care will continue to offer first-class service.